world experienced a collective trauma in 2020 when the pandemic settled down on every human being. Since that time, we've been seeing the long-term impact of this trauma manifesting in multiple ways, particularly among the children and youth we love. Some of them are reportedly experiencing the highest levels of mental health and trauma in history. Joining me now to talk about this is Dr. Karen Wang, who serves as an adolescent inpatient psychiatrist at Sunnybrook Health Sciences Center and a psychiatry consultant at Tyndale Wellness Center at Tyndale University, and registered psychotherapist David Dwarka. Welcome to 100 Huntley Street, Dr. Wang and David.
Thank you.
We know across Canada, many people are seeing the residual effects of the pandemic and trauma that impacted young people. Dr. Wang, that trauma and others that impact young people, what are those traumas that could be impacting a young person we love?
So there are many different ways in which trauma or traumatic experiences can, arise. We know that, for example, children are often exposed to various forms of violence. Maybe they're seeing violence in the home, so that could be domestic violence, domestic disputes. There's also lots of bullying going on. There's so many losses as well that kids have experienced throughout this pandemic. So not being able to celebrate things with their family, not being able to attend school, the loss of those rituals, which are so important for sort of social, emotional development, that has also gone by the wayside. So I think when we think about trauma, it's any kind of experience in which an individual feels extremely overwhelmed. They don't have their sort of typical resources, or they don't feel that they have sufficient resources to sort of cope with the current situation. And we know that, if the trauma or traumatic experiences continue to persist, that there can be negative consequences in terms of their mental health in the long run.
Yes, indeed. And David, your experience as a psychotherapist, as well as, for many years you were a pastor and you are a father, have you seen just in your work in the last 20 years, as well as in your family life, the impact of trauma with young people today?
In my professional work, I've seen kids who have had traumatic experiences. Disorientation is the word that comes to mind, that the world is not what it used to be for them. And so they're trying to grasp and find ways to stabilize themselves and find sort of regain a sense of safety that's been lost. I definitely had students that I've worked with in the counseling space where being in school during COVID was just a mess for them. Left them feeling not able to really engage well in their studies, led to a rise in anxiety and increase in depression symptoms. It has had an impact on them, and it hasn't been easy for them.
I think it certainly hasn't been. And Dr. Wang, for those watching right now, and maybe they're wondering about the young person they love, the child or youth in their care, what are some of the signs and symptoms of trauma in a young person's life?
Sure. So usually when a traumatic event occurs within the first, 2 to 3 weeks, there can be sort of an acute emotional response. And this can be manifested in a variety of ways. Kids can start to have difficulty with things like regulating their mood. They could be very easily upset. Their routines may be disrupted. They may not want to participate as much in certain kinds of activities because basically they're trying to cope with the traumatic situation. Their minds are trying to process what has happened. And, if we're talking about sort of like longer term in terms of what happens when that information is not processed, well, they can start to have, extreme withdrawal. They can start to really get much more depressed. Anything that's associated with a traumatic memory may really start to induce kind of this flight or fight response, or even a freezing response for kids. Kids are typically quite resilient. They may find other ways to cope. But longer term, as they're getting a bit older, they're moving to their teenage years, if they don't find healthy ways to kind of process that, then it may sort of manifest into other types of conditions where they might be using substances, whether it's alcohol or drugs, to help them manage that sort of negative emotion that they had from the traumatic experience.
Wow. And, we know that young people are impacted in this way. And so it's quite heartbreaking as you think about, a young person's worldview and sense of self and others, and even maybe their sense of faith or God within these circumstances. David, in your work as a psychotherapist, what role have you seen talk therapy have in rebuilding someone's healthy worldview of themselves and others and their community?
We're trying to normalize their experience, trying to help them realize, listen, this is not just unique to you. People have been through experiences and have certain responses. And so normalizing just helps to take down this sort of maybe perception of, hey, what's wrong with me? Really, nothing's wrong with you. You're just going through something that many people do as a result of having, been impacted by something that's been a little rough in your life. And so being able to just provide them with a sense of safety and understanding where they can talk out loud about these things and have their experiences normalized. I come back to that. I think that's crucial for their recovery, for their health.
Yes, that's so good, to know that other people are experiencing these same challenges, and you are also not alone as you're going through them when you have someone supportive and caring to journey through with you.
Yes.
Dr. Wang, when you think about clinical approaches to treating trauma, what are some of the options out there?
Yeah. So, one of the forms of treatment that we utilize for kids and for teens is cognitive behavioral therapy. It's, with a specific focus on treating sort of PTSD. And in that model of therapy, what we're addressing are one's thoughts about themselves, about the traumatic experience, about the world. Because oftentimes what the trauma does is that it creates this distorted worldview, right? So it starts to make the person feel like there is no safe space. There is nobody that you can actually trust. And so in cognitive behavioral therapy, what we're trying to do is really help them to think more in a balanced way. And then there's also the behavioral approach. So a lot of times when someone has had a traumatic experience, they're actually avoiding certain situations. They may be avoiding people. They don't want to associate with certain individuals. And so we actually have to start gently encouraging them to move back towards things that they were doing before. Instead of avoiding, which helps to keep sort of recreating that fearful state and reinforcing that anxious stance, we want them to be exposed in a gradual, gentle fashion to things that they are afraid of. I think the other piece that you mentioned, David, about psychoeducation is so key. So a lot of times it's also helping them to recognize, what are your emotions? What are you experiencing in your body? Let's observe and notice what's happening and describe that without judging yourself, without blaming yourself. It's fine to express feelings.
And it doesn't just have to be through a counseling connection, but it can be a parent or a caregiver. Could be a youth pastor. That's interesting as well.
Yeah. A lot of times we think that, if you have a traumatic experience and you're struggling with that, you have to go to see a professional. And that's not necessarily true. We know that, many kids, up to even 70% of Canadian kids, are probably going to have a traumatic experience within their childhood. However, that does not mean that every single one of them will develop psychopathology or have a psychiatric condition, because, our minds are neuroplastic. There's a healing process that can occur. And so we would like to see kids actually connecting with a stable, loving caregiver, someone who can provide those corrective experiences. And it doesn't necessarily have to be a therapist. It's anyone that really wants to stay connected to this person and is willing to sort of be there for the ride and support them.
That's so good. And, it's so encouraging to think that we can take these, what seem like smaller steps, but they're not. They're very big steps in connecting a young person to someone who's safe and is loving and caring. And David, you've seen that kind of healing happen in your psychotherapy practice. Is that right?
Yes, I have. Being able to journey, that's the word I often use when I'm talking with clients. And so I've had the opportunity to work with university students who, as a result of the challenges of COVID, couldn't maintain their performance, and so left school and sought out counseling support. And then we began working on rebuilding their competencies, their healthy view of self in order to be able to put themselves in a better mental health position to return to the rigors of university and be able to handle the challenges. And so it's been wonderful to be part of the support system, along with mom and dad, along with friends, sometimes even along with employers for summer job stints, seeing them sort of get back to themselves and feel confident again, and then going and being able to get through a semester and then the second semester and then celebrating that they got through the year without having to come home because, they were able to make the comeback. So it's been a privilege to see that happen.
It certainly is.
Yeah, it is really amazing when you see some teens who've really struggled with a lot of things in their life be able to sort of, still have that sense of joy and purpose.
Yes.
And that in spite of everything that has happened, that does not define them.
Yes.
Yeah.
Mm-hmm.
And Dr. Wang, David, final thoughts for our viewers watching who are parents, their grandparents, caregivers, and they are concerned about a loved one in their care. What resources could they offer, and what words of encouragement do you have?
I would encourage, as being a parent, you sometimes feel like, oh, I don't speak their language. How can I connect? Your words still matter, and your presence still matters. Even when you think I might not be getting through, you keep driving home the message. We love you. We're here for you. There's nothing you can't do, to make us feel disappointed. And, we're in your corner. Kids need that supportive presence in order to keep going. So that's one thing that I would say, that mom and dad, don't minimize your impact. I know the awkward teenage years, we wonder we're speaking different languages, but your words and your presence matter.
I love that.
Yeah.
So good. So good.
Yeah, I would say that, so first of all, the mental health care systems in Canada are very complex. Sometimes as a parent, it can feel very sort of overwhelming trying to figure out which door is the right door to sort of access to get more help for your child. Sometimes it's starting first with a conversation with the child, trying to understand what's going on. Yeah. And then speaking perhaps to your pediatrician, your family doctor, or, because there are a lack of family physicians across the country, you might have to look at other avenues. We do know there's a national resource sort of helpline for kids, 1-800 sort of like kids help phone. Yeah. And so that could be another opportunity if your child is struggling, that they can actually reach out 24/7 to that help phone line to see what are the appropriate regional resources. Of course, if your child is experiencing extreme levels of distress, they're articulating to you that they're feeling suicidal, then you definitely do need to bring them into the hospital for an assessment and make sure that they're safe. But yeah, it's going to be a journey for sure, and sometimes it takes multiple attempts to get the right resources.
Yes, but there is hope, and healing is possible as we go through that journey. There's been so much encouragement in this conversation. David and Dr. Wang, we're so thankful for your time with us and for the way you've encouraged families across Canada in this very powerful conversation.
Thank you.
Thank
you so much for having us.
Yes.
Yeah.